Ghana has made tremendous progress in the fight against malaria by rolling out proven malaria control measures, including long-lasting insecticide-treated nets, indoor residual spraying, proper diagnosis and effective chemoprevention with anti-malaria medications. These interventions have so far helped to reduce the hitherto high death rate of children under 5 due to malaria.
Over the years, as one thing that has been going very well is the deaths due to malaria, which is reducing year by year. So last year we recorded around 333 deaths at the end of the year. So roughly we're getting about one person dying in a day as compared to the previous years. I mean, in 2012, if we take those figures, we're getting about 8 people dying in a day from malaria being recorded in health facilities. We also have seen a slight reduction in the admissions due to malaria, about an 8% reduction from 2012 to 2019.
Notwithstanding the challenges in the fight against malaria, Ghana in 2019 recorded about 12 million suspected cases, with actual cases hovering around 6 million. The first quarter of 2020 recorded 54 deaths. The program manager for the Malaria Control Program, Dr. Kezia Mam, explains what accounted for these.
So what we see is that though we have interventions that work, we don't have the coverage to the full levels that we want. So we don't have people sleeping in ITNs as we would want them to do. We don't have people having indoor residual spraying in their homes as we want them to do. So even though there's been some improvement in the interventions, there is still a large population who are not undertaking any preventive measures against getting malaria. And we feel that that is what is accounting for the numbers that we see.
With a disease that needs multiple interventions, the introduction and development of an add-on, a new malaria vaccine RTS'S or Mosquirix, was welcomed. Ghana was one of the 3 African countries alongside Kenya and Malawi that carried out the Malaria Vaccine Implementation Program (MVIP).
For Ghana, we think that this was a flagship program that was to start. This also showed the impact of the science that we do in Ghana by various collaborators and various clinical investigators. And then it also showed the capacity for African institutions and Ghanaian institutions to conduct research in Ghana for Ghanaians, and then by extension for Africa.
As an additional tool or intervention to treat and fight malaria, RTS'S was created in 1987 by scientists working in a GlaxoSmithKline GSK laboratory. In early 2001, GSK, as a vaccine manufacturer, and PATH, an international non-profit organization's Malaria Vaccine Initiative (MVI), with support from the Bill and Melinda Gates Foundation, entered into partnership to develop RTS'S for infants and young children living in malaria-endemic regions in sub-Saharan Africa. A network of Africa research centers, which include Ghana's Kintampo Health Research Center, was the lead in the consortium of in-country research partners in the piloted countries. The efficacy of the vaccine was established in a phase 3 trial that concluded in 2014.
The vaccine had gone through several regulatory and ethical reviews in the past, but we got involved in the vaccine testing at the stage of the second stage, which is called the phase 2 stage of the clinical trial. And so it was important for us to investigate and really look at the efficacy of that vaccine. And the importance of the vaccine was that at that time it was a vaccine candidate. It was one of the candidates that progressed very fast into the third phase of clinical trials. And at the stage of third phase, the regulators and ethics review will usually review the data and see whether it's good. We can tell that the efficacy is appreciable. That's why it's being used. is able to prevent about 4 out of 10 cases of malaria. And if we compare this to the large numbers of malaria that occur on our continent, we should be making a headway in terms of malaria, in addition to existing tools.
A year on into the 2.5-year duration for the piloting of the vaccine, health experts describe it as a success story for controlling malaria in Ghana. They put work done at 70% while awaiting evaluation and recommendations from partners and WHO for a full take-up into the routine immunization schedules for children under 5 in Ghana.
We are still documenting the lessons from the implementation that is going on. And the results should be available from Ghana and the 2 other countries where this vaccine was deployed in Africa. As soon as the work is completed in about a year or so, we should have finished collecting data and putting things together.
The objective of looking at the evaluation is really to look at how within the existing system, how would mothers or parents perceive the vaccine? Would they take the vaccine to the disadvantage of other vaccines? So these are the things that we need to understand. And that's why we are studying it. We also want to see the impact of the vaccine on mortality. We know that mortality in children is very high. A number of them are due to malaria. So we want to assess to see whether it can actually reduce the burden of mortality. And so 1 year on, I would say that it's been good.
We were targeting around 120,000 to 150,000 children every year. We have gone over 110,000 children. We didn't reach our target. Obviously, in the initial stage, we encountered so many rumors. And with all those obstacles and challenges, it was a bit difficult. With all that, together with our colleagues from WHO and the EPI, we are making success.
Malaria still remains the topmost killer of children under 5, especially. And therefore, any arsenal that will come and add onto the existing one would be welcome. And that is how come for 30 years and over, people have been trying, researchers, scientists have been trying to get a vaccine for malaria. And so anything that adds a spite to your available arsenals, I think will be welcome. And that is why the RTS'S, or simply put the malaria vaccine, we are so excited about it.
An estimated 275,000 children in selected areas of Ghana, Kenya and Malawi have received the first dose of the RTS'S malaria vaccine. Zero malaria starts with you.